Good afternoon, everyone. Thank you for joining us today for this press conference. We've got some exciting news and new development in the fight against COVID-19 in Miami-Dade County. So everyone, please remember to mute your devices. Even sometimes just the sound of your keyboards, recorders, as you're taking notes gets picked up, and then you become the main attraction. And I know the TV stations are recording for their sound bites, and we want the appropriate speaker to be on the screen at the appropriate time. Steve Litz, I'm talking to you. Ha! Okay, so Mayor Jimenez will be speaking first, and he'll be followed by the two University of Miami researchers, and then we'll open it up to questions from reporters. Please be patient. And at the very end, for those media outlets needing the Haitian Creole translation, we will have our Haitian Creole translator coming up live with that information. Okay, so without further delay, I will now turn it over to Mayor Jimenez. Hey, Mayor.
Thank you, Patty. And I'll be having some comments in English and Spanish, and then we'll be turning it over to our medical partners to also answer questions. And so I'm really excited about the public-private partnership we're launching today with the University of Miami Miller School of Medicine on a countywide study to determine the actual rate of COVID-19 exposure in our community. My team has been working on this project for more than 3 weeks. Our goal is to be able to get a snapshot of where the virus is going and how many people are reacting to it. I'm very proud, too, that I believe we're only one of 3 communities in the world to do this kind of a study. The other one is somewhere in Iceland, and then a small town, Telluride, Colorado, that also did this. But we're the largest by far that's taken this endeavor on. We expect to find county residents who've had the virus or even have it at this time and have no clue because they're not experiencing any symptoms. We may also find clusters of infections or other clues that will allow us to be even more strategic and move quicker in our battle. Having that information will help us get ahead of what's happening on COVID-19 and can guide us as to how best use our resources to stop the spread of this virus. So county residents may be getting a recorded message from me starting later today and through the weekend. The call is going out in English, Spanish, and in Creole. I want to thank Florida Power and Light for using its phone data bank to help the county and the medical school get the 750 test subjects we will need every week for this countywide study. I also want to thank Disaster Management Group, a South Florida company, providing this quick and easy blood test that will be taken by a finger prick. Let me stress that this is a quick 15-minute test that can pinpoint antibodies in the blood. It has been used in the United Kingdom, in South Korea, and in China. The accuracy rate is very good, but it's not as definitive as the swabbing tests that are currently being used at hospitals and our drive-through sites. The 750 residents who will be selected at random will reflect our county's diversity in age, gender, ethnicity, race, and other demographic factors. It also reflects a geographic diversity. The testing will be ongoing for several weeks with the potential to test thousands of residents overall. This will give us tremendous insight into the dynamics of this virus. We're also going to have a separate test sample solely for our first responders, and we're developing criteria for them. Yesterday, we received 20,000 tests, and the county's paying about $17 per test to get this project going. We already delivered 3,000 tests to the Miami-Dade Fire Department, and University of Miami, will be conducting all the sampling. I want to give a shout out to Kevin Linsky, the county's water and sewer director, who has been working with the University of Miami researchers to make this study possible. He's been on top of this project every step of the way. And joining me today on this virtual call is Dr. Aaron Kobitz and Dr. Alberto Cualan Martinez. They are overseeing this project and will be able to answer some of your questions. And then thank you very much again for this collaboration between Miami-Dade County and the researchers and the Miller School of Medicine. The name of this study is SPARC-C. That's SPARC-C, which stands for Surveillance Program Assessing Risk and Knowledge of Coronavirus. No community of our size in the United States has taken on such a study. So I'm really proud of this public-private and academic partnership and for everybody stepping up and joining us together. Now I'll say a few words in Spanish before I take your questions, and we'll have our two researchers here who can also answer questions. Buenas tardes a todos. Estoy súper contento por la colaboración que empieza hoy con la Escuela de Medicina Miller de la Universidad de Miami. Estamos trabajando juntos para un estudio a nivel condal para saber cuántas personas de verdad han tenido COVID-19 en la comunidad. Mi equipo lleva... perdón. Mi equipo lleva 3 semanas en este proyecto. La meta es poder ver cómo se está moviendo el virus y cómo la gente reacciona en él. Anticipamos que vamos a encontrar gente que ya tienen el virus o han tenido y no lo sabían. Y es posible que vamos a encontrar el virus en grupos. También podemos descubrir otras cosas que nos van a ayudar a cambiar las estrategias y actuar más rápidamente en esta batalla contra el COVID-19. Tener esta información nos va a ayudar a usar los mejores recursos para parar el contagio del virus. Así que empezando hoy y durante el fin de semana, algunos residentes del condado van a recibir una llamada con un mensaje grabado por mí. Gracias a la Florida Power & Light por ayudarnos con su lista de teléfonos para que el condado y la Universidad de Miami puedan buscar las personas que necesitamos para este estudio. Gracias también al Disaster Management Group, una compañía del sur de la Florida, que nos ha ayudado a tener este examen de sangre que es fácil y se hace solo con un pinchazo pequeño en el dedo. Es importante decir que el examen es rápido. En solo 15 minutos detecta los anticuerpos del COVID-19. 750 personas cada semana van a formar parte del estudio. Van a variar en edad, raza y otros factores. Vamos a hacer las pruebas durante varias semanas. Vamos a tener un grupo aparte para hacer la prueba con los equipos de primeros auxilios. También ayer recibimos 20,000 pruebas que vienen del condado. Estamos pagando $17 por prueba para empezar este proyecto. El Departamento de Bomberos ya tiene algunas y se encarga de la muestra. Quiero darle las gracias a Kevin Linsky, director del Departamento de Agua en Cantareao, que ha trabajado con los investigadores de para hacer esto posible. También con nosotros en la llamada hoy está la doctora Erin Kovitz y el doctor Alberto Cabán Martínez, que están en cargo del proyecto y pueden contestar sus preguntas. Ninguna comunidad del tamaño de Miami-Dade ha hecho algo así en el mundo. Y me da mucho orgullo que tenemos esta colaboración pública, privada y academia. And now I'd like to turn it over to the researchers who can talk a little more about the scientific side of things. And Dr. Kovitz, we'll start with you.
Thank you, Mayor Jimenez. We are so honored to be doing this work with you. All of us are moving in the dark somewhat in terms of understanding the true burden of coronavirus infection in our community. And this unique study will provide us the opportunity to estimate the burden of disease, including among individuals who are asymptomatic. It will help us also understand how some of the initiatives that have been put in place are affecting our curve of infection. There are likely 8 to 9 individuals positive for every 1 individual that's reported to the Department of Health. And through this work, we will be able to better understand who is infected and, more importantly, what we can collectively do about it. My colleague Alberto Cabán Martínez is going to speak a little bit more about how the University of Miami is using this unique opportunity to provide additional educational training for our students, many of whom are not able to fulfill some of their learning requirements because of the pandemic and its implications for travel and clinical coursework.
Thank you, Dr. Kovitz, and thank you, Mayor. So this partnership with the county brings together a huge alliance in our government and academic partnership. What this project will also do is give us the opportunity to train the next generation of public health and medical doctors through this project. We'll basically have a phone line that will be staffed by public health and medical students from the University of Miami who speak English, Spanish, and Creole. These students will conduct an initial screening and then schedule the volunteers who consent to go to one of 10 testing sites designated solely for this community initiative. Members of Emergency Medical Services and Miami-Dade Fire Rescue will be administering this very simple finger prick test, and the results will be provided to the participants the very next day. So we'll be collecting and analyzing that data to be able to inform decision-making of what the prevalence of COVID is within our county.
All right, thank you so much. And I think we're ready now to take some questions. So we will start it off with Steve Litz from NBC6. Steve. You have to unmute now, Steve.
Thanks. Thank you very much. I appreciate it. Mr. Mayor, I was just trying to get some clarity on this morning's executive order. I believe it's number 17. Is that right?
Probably, yes. We've had
Yep.
a lot, yes.
Yeah.
Right.
Just for clarification purposes, this includes, with respect to reducing the numbers of people inside, it includes all the major grocery chains, Publix, Winn-Dixie, et cetera, correct?
Yes, it does.
And I was just curious that there's some language in there that says stores that sell unpackaged food for consumption. What does that mean?
Well, that means like salad bars and stuff. Okay.
Oh, okay.
That, some of these that they can't do that anymore.
Sure.
Okay.
And lastly, I appreciate it. Have y'all gotten specific complaints regarding workers in grocery stores not wearing gear?
Yes, we have, but we also have gotten complaints about grocery stores allowing too many people in and crowding, and that's why we have the distance requirements. That's why the grocery stores also have to put the markers down on the ground as much as possible when feasible to keep people at the social distancing, the distance of at least 6 feet apart.
Thanks. And lastly, on that matter, it's a recommendation from your order, and then I did hear from Publix they're not requiring. So again, we're just asking these store employees to take these precautions.
Yes, we are. But sometimes it's not feasible, and so yes, we're asking them to do that whenever feasible. If in fact they have the equipment, some people don't have the equipment that they need.
Thanks, Mayor.
You're welcome.
Next up is WSVN Channel 7.
Can you hear me now?
Yes.
There you go.
Okay. WSVN crews have been noticing, especially outside of pharmacies and grocery stores, a lot of surgical gloves, used gloves, laying on the ground, helter-skelter all over the place. What do you say to those people who are just dropping those contaminated gloves on the ground and not even attempting to throw them away properly?
I say that number one, for just the health reasons, to try to stop the spread of this virus. That means somebody else is going to have to come and pick up the glove and stick it somewhere in a garbage. That in itself is a problem. That's a health hazard, and they shouldn't do it. They should find a receptacle and put it in.
Is there any specific punishment for those people if a police officer sees them doing it?
You know, that's littering for one, okay? And so littering is against the law in itself. And so that's the number one thing. It's littering, but it's also a health hazard. And then, you know, really at this point in time, do I have to actually write an order that says, put your gloves in a container? I mean, if I have to, I will, but it already is littering. Just put your glove in a container so that it won't be a health hazard to the next person that's going to pick up the glove and put it in the ground, whether it be a good neighbor that's going to do that, or it's going to be our solid waste workers that are going to then have to do that. So that's just, you know, that's just being courteous and common sense. Put it in the receptacle.
Thank you.
Thank you, Mayor. And up next is Wendy Grossman from WIOD. Wendy. I think you're still on mute, Wendy.
Can you hear me now?
Yes.
Okay, sorry about that, Mayor. Once the people are picked for this study, like where do they go to take these blood tests? And then what do you do with the information once you get it? Will this change the county's response to COVID-19 in any way?
The answer to that is that there's 10 different locations, and the question is, will it change our response? We don't know. Maybe we can let the doctor answer that question as to what she expects and how that information can help us in Miami-Dade County. And actually, I think around the state, around the country, because I think we do have a very diverse community here. And I think what we find in Miami-Dade County probably can be correlated to other dense urban areas around the states. Doctor?
Thank you, Mr. Mayor. So while I can't speak about whether what we find will inform local practice and policy, I do believe that this is the first true community surveillance initiative that's occurring nationwide. It's different than what happened in Telluride, where every individual was screened. We're randomly picking a group of individuals whose demographic background is truly representative of Miami-Dade County. And I think all of us in the press conference today would collectively agree that the demographics of Miami-Dade County are the future of the United States. And so when we do this work here, we provide a window into how corona is not only affecting us locally, but the rest of the United States and probably the larger Western Hemisphere. I think we're going to have very important information that helps us better understand how coronavirus is playing out. Right now, most of the data that we have is coming from other parts of the world. And we need to know what's happening locally in order to really respond appropriately from a public health perspective.
Thank you so much, Doctor. Now up next is WLRN's Jenny Stiletovich. Jenny, are you on the line?
Yes, I am. Thank you. Can you hear me?
Yes.
Okay, great. So I have a question for the doctors just about the specifics on the study. Can you tell me, you picked 750 for the sample, why that number, and what questions are you specifically hoping to answer when you talk about how this spreads? Are you getting detailed information from the people you're testing about contacts? Can you just explain a little bit more about what kinds of questions you think you'll get answers to?
Okay, so I can start and then I'll let Alberto chime in. We're a bit of a tag team. So it's not just 750 people. It's 750 people a week for a 4-week period. And the reason why that's critically important is as we do this longitudinally, we have the potential to observe how the curve of infection is changing locally. And that's really important because I'm sure you have heard that we really expect the onslaught of COVID-19 burden to occur in late April, early May in South Florida. So we will be doing this in a way that will allow us to assess how infection burden is changing and also allow the mayor to make operational decisions as we denote those changes in live time. Everybody who participates in the study will be given a brief questionnaire over the phone that helps us assess their personal risk of COVID, their experience with COVID-related symptomology, their contact with anybody who may have been affected by COVID, as well as comorbidities that could potentially affect how well they recover from COVID. And then they'll come to the testing location and do the point of care serology test, which allows us to know whether they have active infection, ongoing infection, or prior infection. And I think this is another really important part of the data that we're collecting is we're not only going to be able to estimate prevalence, we're also going to be able to understand which segments of the population have been exposed differentially and how that's changing over time by geography and within important population subgroups. And so this will be the most comprehensive look of what's happening at COVID in a municipality the size of Miami-Dade County.
Did Dr. Caban-Martinez want to comment as well on this?
Yeah, no, that was a great summary. And I would just add, for the kids that are out there watching, these news segments, this is why math is so important. You may be wondering why we're choosing 750 people over 4 weeks, each week a new 750. So if you think about how many people we have in our county, which is almost approximately 2.8 million people, using some fancy math and sampling frames, we're able to pick out people that represent our population and really infer how that prevalence is in a certain amount of time and how that changes over the 4-week period. So this will give us an opportunity to use our resources wisely and strategically, and also be able to represent our county completely.
There you go. So all of you doing homeschooling, there's a new math problem for the kids there. Okay, New York Times, Patricia Mazzei, you're up.
Hi, Al. Thank you. So for the people who have antibodies that they had the infection, is the idea that they could either, be the first people who go back to work from a public policy standpoint, or should we not read anything into that because of what Dr. Kobit said, that the test, the fingerprint test, finger prick test is not quite as definitive as the swab?
Who wants to take that?
Okay.
So do you want me to take that?
Yes.
So in the community surveillance study, we are not making recommendations to people based on results. We will obviously share the results with everybody who volunteers to participate, and we'll provide some corresponding health education that enables them to appropriately interpret the results, as well as to understand what they should do in the event that they are positive for antibody and may be experiencing symptoms. Now, I know that there are local healthcare systems that are considering using this test in the way that you're suggesting, whereby we can identify individuals who have prior COVID-19 infection, and based on that blood test and their self-report of an end to symptoms, could safely return to the work on the front lines so that we don't decimate our ability to appropriately respond to public need.
And if I could add, this doesn't preclude that if a new technology that comes in, which is much more accurate and just as good as a swab, that we won't then, ask the University of Miami, okay, you did this, now do this, and let's see how that comes out, and then use that test to determine if somebody goes back or not. And really, a lot of it depends on the accuracy of this particular test, and then the risk that you're willing to take as an entity. If we are running out of firefighters, let's say, because they're either exposed through their work or because of their colleagues, then we may have to take certain risks with that, because we can't run out of firefighters. We have to have firefighters. We have to have police officers. We have to have corrections officers to provide certain services that are vital to this community. And so this test may very well be used for that. But hopefully, and I think that there are other tests coming that are a little bit more, a little bit more accurate, that can actually be used for clinical diagnosis.
Thank you, Mayor. Thank you, Doctor. Okay, let's move on now to Phil Praisen, also with NBC6. Phil, are you there?
Yep. Can you hear me okay?
Yes.
I guess I have a question of just how this would relate to governing, because, I'm super interested in just information and this kind of action, just to know more. But for somebody out there who wants to know, like, how this kind of study will impact them in their daily life, Mayor, like, what kind of decisions could come off of this information? Like, what will this inform for you then to do X or Y?
Well, depending on the level of infection, let's say that we find that there is a very big cluster somewhere in a certain part of Miami-Dade. Maybe we may have to take more aggressive action in that part of Miami-Dade. Maybe inform the people that live in that area, hey, you have a very high incidence of infection there. Now, should it change the way that people are acting? Probably not, because what I'm telling everybody is assume that 100% of the people that you're dealing with have COVID-19. That's the one way that we assure ourselves that we try to protect each other. But from a policy perspective and actually a action perspective, the more information that I have at my fingertips, the more information that decision makers have, then the better decisions that they're going to make. The one factor that we don't have, that anybody has, nowhere, okay, is what percentage of the population is actually infected, and are there groups somewhere? Because all we're testing right now are people that are 65 and over, or people that have had that are having symptoms. Well, that's more apt to be positive. But there may be a whole ton of people, and I expect that we're going to find a ton of people that have no symptoms whatsoever. They never even knew they were infected. All right, and where are those people? Because actually, those are probably the most dangerous ones of all. The ones that show nothing, and you walk up to somebody because the individual shows nothing, no symptom whatsoever, and they're actually, infectious. They're probably the most infectious one of all. If somebody's sneezing, coughing, etc., you're probably going to stay away from that individual, and you as an individual are going to stay away from other people. So, yeah, it's very valuable information.
Thank you. Up next is Doug Hanks with the Miami Herald.
Thank you. So, Mayor, can you talk about what metrics you're going to use to decide when any of these measures can be relaxed, lifted, or changed? And will this testing effort be part of that decision making?
The decision will be made, by myself using in constant contact with medical experts and people that are experts in the field of infectious disease and the steps that have to be taken. And so we're not at that point, obviously, right now. And so there is how do we start to ease up? I would expect that you would start to ease up. You wouldn't just say, okay, today everything's back to normal. I think you start to ease up, risk, do a risk assessment, said this kind of activity is okay. But I don't have the answer to you right now. I mean, we won't know until we get more data and we have a reduction in the incidence of this virus. And so again, the more data we have, the better it'll be for us to make those decisions with some data behind it, so that the experts can guide me in what the steps that we need to take.
And will this test be part of that decision making, this testing effort?
Maybe, and maybe some more accurate testing, but this methodology probably will be part of that decision making. If we get a 100% accurate test that is easy to administer, easy to detect, it will probably be a great piece of data to know, hey, the infection, it's on its way down. We've got a very, very low, risk now of easing up some of these measures that we've taken. So yeah, I would expect that something like this will be very useful, and also depends on how expensive it is. This is a relatively inexpensive test, relatively easy to administer, and very fast results. Now, when we get to even greater accuracy, I think it's a very valuable tool in the things that we want to do.
Thank you very much. Okay, let's take a few questions in Spanish, but first I want to remind everybody, once you finish asking your question, please go ahead and mute your device back up again so that we don't get any interference when the mayor or the doctors are speaking. Let's go now to Arlie Alfaro with Telemundo 51. Arlie.
Buenas tardes, alcalde. Sí, quería preguntarle si este examen va a cambiar la forma en que se está detectando el COVID en el condado, y si puede explicar un poco la forma en que también en que va a funcionar primero con un grupo de personas, creo que dijo de unas 700.
Bueno, primero vamos a tener 750 personas cada semana por 4 semanas. Hay un mensaje que va a recibir muchas personas en el teléfono este fin de semana pidiendo si quieren ser parte de este estudio. No tiene que tener síntomas. Deseamos personas que son representantes de la comunidad, y también no solamente en raza y si son hombre o mujer, de edad, pero también dónde están localizados en el condado de Miami-Dade. Y sí, esta información yo creo que es muy, muy importante para que las personas que están tomando decisiones tengan mejor información sobre las decisiones que tienen que tomar para asegurar la salud de nuestros residentes. Así que para mí, estoy muy orgulloso que vamos a ser, yo creo que la comunidad más grande del mundo que va a tener este tipo de estudio. Nada más que hay en Islandia, tiene un estudio, y también en un pequeño pueblo en Colorado, Telluride, hicieron un tipo de estudio así. Y esta información va a ser muy vital, muy, muy informativa, muy esencial y importante para no solamente Miami-Dade, pero también yo creo para el estado y también para el resto de los Estados Unidos.
Gracias, alcalde. Ahora vamos a seguir con Wendy Pineda de Conéctate. Wendy, ¿estás ahí?
Sí, ¿cómo está? Muchas gracias.
Bueno.
Alcalde, bueno, primero felicitarlo por su gran liderazgo, y en este momento ya me han respondido muchas de las preguntas que le iba a hacer, pero quiero que le dé un mensaje a toda la comunidad de que mantengan siguiendo las reglas y que también tomen esto con mucha disciplina social. ¿Cuál sería ese mensaje para la comunidad?
El mensaje mío es muy consistente, es más seguro en casa, mantengan la distancia social, salgan solamente para hacer las cosas que son esenciales para ustedes. Tienen el derecho de hacer eso, pero cuando salen, por favor, mantengan la distancia social, háganlo de una manera que no se va a pasar el virus de una persona a otra. Si tose, no lo hagan al aire, que tenga un pañuelo, un tissue, un Kleenex, y bote el Kleenex después. Lávense las manos mucho más frecuente. Si toca una superficie, por favor, asume que está infectado de superficie, también lávate las manos, no te toque la boca, no te toque la nariz, etcétera, con sus manos. Y eso es lo que tenemos que hacer, y mantenerlo en la casa. Pero mantenerlo en la casa no quiere decir que pueden tener fiestas y eso, y traer personas de afuera para su casa, porque tiene que asumir que todo el mundo está contaminado. Todo el mundo tiene el COVID-19. Y si hacemos eso, podemos empezar a bajar la tasa, el índice, los números de las personas que están infectadas en el condado de Miami-Dade.
Gracias, alcalde. Creo que teníamos una persona más de América TV en español, Adriana Navarro. No sé si está en la línea o no. Adriana, are you there? América TV? I can't tell if she's online. Okay, so we'll move on. Phil from NBC6 had a follow-up question.
Okay.
Phil, are you there?
Yep. Can you hear me okay?
Yes.
Just because I was reading this morning about there's some news about how the governor's executive order overrules some local ones in Tampa, but just want to get a better idea on if it does overrule anything here in the county.
We're looking at the governor's orders, and then the governor said subsequent to that it did not. If you had more stringent rules in place, that it would not be overruled. But we're looking at the order itself, and then if we have to make some recommendations to the governor to clarify it in a way, in an order, then we will do so. Right now, everything that we've done in Miami-Dade County stays in place until told otherwise. All right, and so we're looking at that right now.
Thank you, Mayor. Brian Bandel from the South Florida Business Journal is on the line. I believe he may have a question. Brian, are you there? Nope. Okay. All right. Let me see who else is up. Andy Slater with the Andy Slater Show.
Can you hear me? It's Brian.
Oh, hey, Brian. Okay.
Hey, it's on the unmute button. Hey.
Okay, you can go for it.
So I wanted to know if this could help you figure out in certain businesses that are allowed to be open, the essential businesses, if there's spreading of infection there. I've had some people concerned that infections were spreading at construction sites, at grocery stores. Do you think this can help you pinpoint which of these places might still be a risk for people?
I'm going to let the doctor answer the question, but I believe that we're looking at geographically and demographically. And so I don't think construction workers, they may be one ethnicity, so I don't think so, but I'll let the doctor answer that question.
So Mayor Jimenez is entirely right. We are looking at minor statistical areas across Miami-Dade County. And so these are broad geographies, and we are looking at individuals within those geographies, but not specific places that individuals within those geographies may work or play. And so I think it'll be really hard through this particular initiative for us to get the answer to the question you're asking. But I do want to say that one of the things we will learn from this initiative is the proportion of people who are asymptomatic and infected. And I think that is a critical component to what you're asking us about, because without being able to accurately estimate how many asymptomatic individuals are in fact positive for COVID, we don't really know how they are engaging at work and in play or socially in such a manner that it may unintentionally further the transmission of infection.
Okay, thank you so much, Doctor, for that. And now Andy Slater with the Andy Slater Show. Andy, you there?
Yes, this is for the mayor. As far as containing the virus, what did you think about Mayor Francis Suarez's letter to President Trump about suspending certain flights into MIA?
I think he wanted to close MIA down. First of all, it's not his purview. MIA is it's Miami-Dade County, and our airport director has already written a letter to the FAA and probably to the White House itself saying, please disregard the letter. MIA and the flights in and out of MIA are vital to Miami-Dade County. MIA is one of the few pharmacy centers, airport farm hubs in the world. And so a lot of medicines fly in the bellies of those passenger airliners into MIA and are distributed around the country. And a lot of other things. We're the #1 cargo airport in the world too. I mean, in the United States, international cargo. So no, we are not going to close MIA. And I've already spoken to the White House also about it and say disregard the letter. It's Miami-Dade County that controls MIA.
Okay, Andy, you good with that? You have another question or no?
No, good. Thank you.
Okay, no problem. I know I see the SFLCW is on the line. I don't know if Melissa has a question. Melissa, are you there? And did you want to ask a question? No? Okay, I see someone from CNN on the line as well. Does anyone from CNN have a question, or are you all just listening in? Okay, anyone else have a question for the mayor or the doctors? Okay, I guess we're good then.
Good.
All right. Thank you everyone for joining us.
Sorry, disculpa. En español, uno de los doctores puede decir algo.
Doctor Cabán Martínez, ¿habla español?
Sí, por supuesto. ¿En qué pregunta le puedo contestar?
Si podría explicarnos qué es lo que está buscando, qué es lo que va a poder encontrar a través de esta prueba, doctor.
Sí, cómo no. Primero es un orgullo de poder colaborar con el alcalde en este tipo de proyectos para poder tener un entendimiento de qué tipo de infecciones tenemos dentro de nuestro condado en las personas que están viviendo. Básicamente nosotros pensamos que hay un subestimado que está significativamente en la prevalencia de esta enfermedad de coronavirus dentro de nuestra población en general. Quizás a lo mejor 8 o 10 personas están infectadas. Con este estudio único que se está actualizando ahora dentro de nuestro condado, vamos a tener mejores entendimientos de esas enfermedades dentro del condado. Tenemos la expectancia de que este estudio nos pueda informar no solo del punto de vista científico, pero sí también del punto de vista práctico de póliza en cómo nosotros podemos proteger nuestro poblante del condado sobre esta enfermedad.
¿Tiene que ver con los anticuerpos en la sangre de la persona?
Es correcto. Nosotros vamos a utilizar una prueba que está buscando, por ejemplo, los anticuerpos que está dentro de la sangre. Es una prueba bien sencillo. Se hace un pinchito en el dedo índice y con una gotita de sangre nosotros podemos buscar los anticuerpos que están ahí. Básicamente son dos, la G y la M. Y esos dos anticuerpos nos dan información si la persona estuvo expuesto a ese virus recién o hace mucho tiempo. Entonces, nosotros podemos tomar decisiones más informadas sabiendo qué tipo de la población está impactada con el virus y con qué intensidad, ¿verdad? Dependiendo si están recientemente infectados o hace mucho tiempo que están infectados.
Gracias, doctor.
Con mucho gusto.
Does anyone else have another question at all? Okay, so before we wrap up, for those of you interested, we will now bring on our Miami-Dade County translator to give you the information that Mayor Jimenez spoke about at the very beginning in Haitian Creole. His name is Lionel Lebour. Lionel.
Bonjour, non pas M. Lionel Lebour, département de communication contre Miami-Dade. Nous parlons pour nous déclaration que Mayor Jimenez a fait, Carlos Jimenez a fait dans la langue anglaise, nous parlons pour nous en créole. Bonjour tout le monde. Je suis très content pour le partenariat public-privé qui est lancé aujourd'hui avec l'école médecine Miller dans l'université Miami pour une étude dans le continent pour déterminer le pourcentage réel du monde qui est exposé à COVID-19 là dans la communauté. L'équipe travaille déjà plus que 3 semaines et l'objectif là, c'est capable de gagner une idée sur le côté virus là aller et qui genre monde réagit par rapport à lui-même. Nous espérons joindre qui côté et qui genre virus là fait mouvement et nous espérons joindre monde qui gagne virus là et monde qui te gagne avec monde qui peut manifester aucun symptôme. Nous sommes capables de joindre une prochaine infection ou soit l'autre indication qui va permettre de nous développer une stratégie pour nous aller plus vite. L'information ça va aider nous à aller devant le virus là et puis ça est capable de guider nous sur la meilleure façon pour nous servir à ressources nous pour nous suspendre la propagation du virus là. Qui donc le président nous va recevoir message que nous va enregistrer pita jodia avec la fin de semaine nous va voir appel ça va dans langue anglais créole avec créole. Moi je voulais remercier compagnie électricité avec lumière en Floride qui permettent que nous utiliser base de données téléphoniques pour nous capables de joindre monde qui doit participer dans l'étude ça dans la communauté. Moi je voulais remercier le groupe gestion des as qui c'est une compagnie dans Sud Floride qui fait test rapide et test va permettre que seulement rapidement piquer droite mounio et puis effectuer le test là. Moi je voulais insister que c'est un test 15 minutes qui va permettre d'identifier anticorps qui viennent ensemble. Et yo déjà servi à test ça dans le Royaume-Uni, dans Corée du Sud avec la Chine. Exactitude test ça très bon. Cependant, il n'est pas aussi définitif que le test que vous fait avec applicateur, que vous appliquez dans l'hôpital avec notre section test côté vous fait test sur volaille. 750 personnes que nous allons sélectionner au hasard, nous allons refléter diversité en termes d'âge, genre, ethnicité, race, avec l'autre facteur démographique encore. Et il va refléter tout, diversité géographique que nous gagnons dans la région. Cette investigation va durer pendant plusieurs semaines et il y a une potentialité pour tester plusieurs milliers de monde à la fois. Échantillon test, nous allons gagner un échantillon séparé pour une première secourission et ça va permettre nous assurer nous que nous sommes capables de retourner travailler dans la première bataille contre COVID-19. Hier, on a recevoir 20 000 tests. Tests, nous payons $17 par test. Nous déjà livré 3 000 là-dedans par département pompier dans Miami-Dade avec UM. Il va conduire ça qui a un rapport à échantillonnage. Moi, je voulais gagner un mot en particulier pour Kevin Linsky, qui est directeur de l'eau à Ego, qui a participé directement avec l'Université Floride pour te rendre étude ça possible. Je joins moi aujourd'hui dans rencontre ça, Dr. Erin Cobbett avec Dr. Alberto Caban Martinez, qui gagne j'ai l'ouvri ce projet ça. Nos projets, c'est Spark C. Livre le dit en créole, programme surveillance, évaluation, risque à connaissance sur coronavirus. Moi, très fier de partenariat privé, public avec académique ça, et me gagne pile fierté pour tout le monde qui vient porter coller avec nous dans le ça. Merci en pile.
Thank you very much. Thank you everybody for joining us this afternoon. Have a good weekend.